Hi, I'm Dr. YVRao, plastic and cosmetic surgeon from Dr.YVRao Clinics, Hyderabad and Vizag. Today, I'll be operating at Hyderabad Center a case of a 28-year-old boy who complains of a very sharp nose, that is the very sharp tip, and excessively long nose and humpy nose. This is almost, we can call it a parrot beak type of nose, where the parrot beak, it goes like this. The nose comes and then goes tip downwards like this. So normally the tip should project up. The tip should be the most prominent part of the nose, whereas in him, more than the tip, the part above the tip seems to be more defined, and the tip is drooping down, and tip is very sharp. We can even see the cartilage edges also. So what I have planned is reduce the hump by means of a chisel, and if required, do cut the bones and narrow them and open these cartilages. And what we do is we try to modify the cartilages or cut the medial portions and then the lateral portions and depress them a little down and then modify them, and if necessary use a tip graft or either onlay or some other tissue graft modifications I'll use. And then these are the changes that I'm planning. So I'll be starting this hump and a large nose and with excessive length of the nose. So what I'll do is open rhinoplasty. So I'll make a small inverted V cut here, then extend them inside like this, like butterfly wings. So the difference between open and closed is only this 5 millimeters incision, that's all. Some people make it here. I prefer the junction of that is where this is the narrowest part probably. That's all. This is the difference between, this small incision is the difference between open and closed, which is hardly visible in the due course. So this is the lower edge, I can see it, which corresponds to the skin, which bears the hair and hairless skin. This is usually the part of the skin, and this is mucosa. This is called the transition zone. This is where we go and enter the nose. You can see it better here on this side. This is called infracartilaginous incisions. That is below the cartilage. So I join these two together. Check this. So repeat the same thing on the other side. Because he is a very skin thin, so we should be a little more careful. The reason being, we can cut the cartilages if we use a little more force or while making the incisions. So all this comes with experience, definitely. So we just go above the cartilage, not closer to the skin, but close to this mucosal side, mucosa and cartilage, because cartilage is very close. Please attach it to this layer, not to the skin. Now, so you can see the edge of this cartilage. This is the lower lateral cartilages, which contribute mainly to the shape than to the airway. Whereas the cartilages inside, these are upper laterals we call them, they contribute mostly to the airway, that is maintaining the airway. Any architectural difference in the upper lateral cartilages especially are due to injury or some other reasons, so that can give rise to breathing problems, or either it is post injury or post surgical. So now we'll open. So in some people the skin is very thin, so one should be more even. Very thin people, we should be even more careful. While elevating the lifting the skin should not be very thin nor very thick also. There is something called optimum. This way. So join these two incisions. As I mentioned, in thin skin people, one should be a little careful. Wait a second. Our scissors should not go close to the skin, it should go close to this mucosal layer. Light properly. So if we were careless in these steps, what happens is we can even destroy this cartilage, which is very essentially maintaining the shape of the nose, especially the nostrils. Come this much better. So after exposing these cartilages and the dorsum, so now we're exposing the septum, so which needs to be tackled. So these cuts are only to reflect the perichondrium, that is the flimsy layer covering the cartilage. So this is the perichondrium. From outside I can show you. This is the perichondrium. From inside it looks white, from outside it looks pink. So what we have to do is we have to do resect or increase the size only of the cartilage, not the perichondrium. So outside is a simple protective layer. So as I mentioned earlier, the cartilages are very flimsy. So usually it's better to start in this area because it can be separated. That is the covering layer, perichondrium can be separated very easily in this zone. So a little of some scratching and some other manipulations we try to separate this layer. Once we separate at one point, then we can sweep our osteo, this elevator, other side, కొంచెం అటు పట్టుకో అంత లాగొద్దు గట్టిగా లాగొద్దు. So we come to know with experience that whether we reached the cartilage or not. I have not yet reached it. This takes a few minutes more. అంత గట్టిగా నొక్కొద్దు. So this is the final picture before closure, and then I have sutured even the upper laterals also. So, and there is no irregularity, and this is smooth curvature, and I have placed in a shield graft also, and the only tip graft also. I have reduced the lower lateral cartilages on both the sides, and I have sutured them, and that's all. So now we'll see how good is, or rather how bad is our nose. Yeah, come to this side, and some to the side totally. So this is the final picture before closure. The hump is gone. The tip is nicely elevated. Yeah, this is the picture. So after closing we'll see. Front నుంచి చూపించండి. Yeah, there will always be some amount of swelling which reduces with time. Yes, sir. So after exposing these lower lateral cartilages, so I'm going on to the torso. There's a whitish, white structure. So here I kept the perichondrium, which is a thin layer around the cartilage, protecting the cartilage. Here I am denuding it off. That means going below the perichondrium. So right, because I want to expose this septal cartilage on both the upper lateral cartilages. This is the site of the upper lateral cartilages. 1 second. Of which